Hello, everybody. Thank you so much for joining us today for our next session of the Feline Education Series. Today, we're going to be talking about panleukopenia, a virus that affects unvaccinated cats and kittens. And we have a special guest here today joining us, Dr. Cece. Thank you so much, Dr. Cece. Do you want to introduce yourself a little bit?
Sure. I'm Dr. Cece. I've been with the organization over 40 years. So I've had various jobs here, clinic vet, director of shelter medicine. I work a lot with the cruelty department on forensics. And now I do community vet where I go out in the community and see people who have challenges, both transportation and financial. So we help them out by going right to their home and doing preventative care for their pets.
Thank you. We are so lucky to have your expertise on our team and part of the organization, and really glad to have you presenting on this topic today. So with that, I'll go ahead and get us into our first
Yep,
slide.
there we go. Okay, so we're talking about panleukopenia today. Um, Panleukopenia is a virus. It's part of this family, which also includes parvovirus in dogs. In fact, they feel that our cat virus mutated and then started to affect dogs in the 1970s. So they're very closely related viruses. They're both DNA viruses, single strand, and they're non-enveloped. And you say, well, why do I need to know about them not being enveloped? Well, the thing is, if you are a virus and you have an envelope, you're pretty easy to kill because all we have to do is disrupt your envelope. But if you're not enveloped, it's much, much harder to kill that virus. And so both parvovirus in dogs and panleukopenia are non-enveloped and very difficult to kill. And they're very stable in the environment. People have done kind of research, and some have said it can live months, and some actually have said under certain circumstances it can actually live years. So it's a virus that really, once it gets into the environment, it's very hard to get it out. This virus likes to attack rapidly dividing cells, which are in intestinal cells, which is why we get that vomiting and diarrhea, bone marrow. Panleukopenia actually means low white blood cells. That's what that word actually means. So both parvo and panleuc cause a really, really great decrease in the white blood cells in these puppies and kittens, which of course makes them more susceptible to bacterial infections then. And it affects kittens under 2 weeks of age, very young kittens and kittens in utero. It can actually affect the part of the brain that we call the cerebellum, which gives you like your coordination and your ability to know like where your legs and your arms are at any given time. So that's something that we will talk a little bit about more as we go forward. Okay, next slide. Okay, and this side is going, you're going to have to keep, yeah. So why do we see this disease? So this is a high risk shelter disease because we have animals coming in from all over the area, and most of these animals have no history. We don't know if they've ever been vaccinated. A lot of them are kittens that we get right out of colonies off the street. So we know they haven't been vaccinated, and a lot of them are in poor health. They have parasites. They may not have gotten good nutrition. So they're really at risk for getting this disease because we know all these things, parasites, poor nutrition, can cause our immune system not to be able to protect us. And again, this is a highly contagious virus, so it really doesn't take much to spread it, and it really is resistant in the environment. So all these things put together really make it an important disease for us to worry about in the shelter. Okay. Now, how is it transmitted? Again, it's highly contagious. It's mainly shed in feces, so mainly in the stool, but it can really be in any secretion. And what we say the most common way it's transmitted is what we call fecal oral, which means there's stool deposited, which has a lot of the virus in it. And then an animal comes along and either steps in it and then licks its feet, or might even lick the area where the feces is. And it goes right from that fecal right into the animal's mouth. And gets transmitted. Now, there are other ways that it can be transmitted. Obviously, it can direct one animal touching another, but the biggest way it's transmitted is by what we call fomite. And fomite just means it's an inanimate object that can transmit a disease. So if I handle a kitten that's got panleukopenia and I don't wear gloves and it's on my hands and I go and I handle another kitten, I've just become a fomite and I've transmitted that virus to that second kitten. And actually they've done studies and the biggest fomite in shelters is actually the staff, because sometimes we forget we don't wear our gloves, or we take a kitten and we cuddle it against us, and then we go and cuddle another kitten and we don't realize that that virus can be on that fur on the feet and that we can be transmitting it. There should be another, yeah, there we go. Our infections are typically acute, which means they happen pretty quickly. And sometimes it's so quick that we find these kittens already deceased, and we don't even have time to say that they've stopped eating or had diarrhea. So that's one of the common ways that we find this disease, unfortunately. Next. Okay, so who's at risk? So most of what we're going to see are in kittens 3 to 5 months of age. That's the real danger time where we're going to see kittens, because as the mother's antibodies start to wear off, then they become more susceptible, especially if they're not vaccinated. But really, any unvaccinated cat can get it. And we have seen adult cats that were unvaccinated get this disease. Most of the cases we're going to see in spring and summer, and this is mainly because most of our kittens are born in the spring and summer, and also because cats tend to roam more often and be out and about in the spring and summer. So we're going to see more this time of year.
I always love to say that resources are aplenty. And whenever there are plenty of resources, that means the population is going to increase. Breeding is happening, right? Those are when we see those things do an uptick in our environment.
Yeah.
Oops.
Okay. Whoop.
That's
Oh,
right.
there we go. Yep. You're right. So transmission, the incubation period. So what that is if I'm exposed to the virus and I'm a kitten, how soon can I be expected to break with that disease? And so really they've done studies. It can be anywhere from 2 to 14 days, but most of the time it's 5 to 7 days after they've been exposed that they actually will start showing signs. Now, the bad thing is they can shed, or they can actually have that virus in the feces 2 to 3 days before they actually get sick. So sometimes we'll get kittens in and they'll look perfectly healthy, and 2 or 3 days later, they start showing signs. And by that time, if we've had them with other kittens, those other kittens could be exposed. So that's why we're always really careful. We try not to mix litters, and we try to be really careful when we go from one kitten cage to another. Okay, our clinical signs, most of the time, like I said, it can be so acute that we don't see these signs. But if we do see them, most of the time what's going to happen is you're going to notice the kitten's not eating. Okay, and then the next thing you're going to notice is vomiting and diarrhea. And the diarrhea can be very watery and very loose. Kittens usually, if they have this, they're going to be what we call lethargic. Or, when you go walk through the kitten room here, if I see a kitten that's just sitting there kind of hunched up like this and not doing much, I'm going to be real worried, because lethargy or just being really inactive is one of the signs that we're going to see, and we can see it early. So, walking through the shelter, if you see kittens running around, bouncing, playing with each other, that's a good sign. But when they're lethargic and they're just kind of sitting there and they're not being normal kittens, that's a red flag for us. And then, of course, sudden death is something that we see. And the course of the disease typically is 3 to 5 days. Now, I've seen kittens who were exposed to this disease and got very few symptoms and recovered very rapidly, and others that had to be hospitalized and were on like IV fluids and everything for more than 7 days. So it can vary, and a lot of it depends on the kitten's condition and also on its immune system. And the other thing is subclinical cases can occur. And we've seen this quite a bit in our dog parvovirus, where a litter will come in and we'll test them and they'll be positive. Some will get really sick, and others will be positive and they won't even miss a meal. So we know that's what we call a subclinical case, where they have it, but they're just not showing clinical signs. And again, this makes it harder for us to keep this disease under control, because if we don't know a kitten has it, it's subclinical and they're shedding, then we may not be as careful and we may end up spreading it.
So yeah, I think this is a really, really important slide and important information to discuss because if someone is in the shelter handling safer kitten care or positive start, this is why we ask for gloves in between each new gloves in between each litter of kittens, because this is a stage where they're really at risk, right? And they may be sick and we might not know. It could be potentially spreading it to another. This is also why we ask people to stop before they enter a cage. If they do see any vomiting, do see any diarrhea or lethargy, don't go in and start cleaning or socializing. I know we might see explosions in the cage and sometimes want to help get them cleaned up right away, but it's really important to make sure we notify staff first so the medical team can get involved so we can decide if we need to do any testing or any quarantine before we move on, because it's really important not to accidentally spread the disease. We don't want it to start almost running out of control before we can kind of get it, contained to one area, if that makes sense. And I love what you said too about, maybe not mixing litters of kittens and why that's really important. And we don't do that in foster homes because we don't know, right? Babies could be carrying it, and we don't want to expose an entire mom and litter, for a singleton. So sometimes it's, even though it's sad, we do have to keep those body babies separated.
And I'm going to just talk a little bit about the cerebellar hypoplasia, which is what this disease, this virus can cause, especially if the mother has that disease when the kittens are in her uterus. And what it does is it affects a part of the brain, like I said, that really how you balance and how you kind of know where all your legs are and everything. So if that part of the brain is affected, it can get the cerebellar hypoplasia. It also can be caused by what we call modified live vaccines, which is what we use in the shelter if they're given during the latter stages of pregnancy. So, if you have a pregnant cat in a home, and the person is going to have that mother cat have the kittens, then certainly they're not going to go ahead and vaccinate that. But the cats that come in to us, most of the time we're going to vaccinate or we're going to spay them anyway. And most of the time they haven't had any vaccines at all themselves. And so in shelter medicine, we feel that the risk of the mother getting that disease and dying and all the kittens dying is greater than the slight risk caused by using that vaccination. And I just want to point it out because if if your veterinarian says, "Oh no, don't vaccinate the pregnant cat with the modified live," that's fine in a home situation. But in the shelter situation, like I said, it's more of a risk for that mother and kittens to not be vaccinated. We vaccinate them as soon as they come in.
That's great.
And so it also, this disease can also cause abortion or the pregnancy not to go to term, so we can have dead kittens with that. But if they get the cerebellar hypoplasia, and you probably have seen kittens like this, they are kind of what we call ataxic, which are kind of out of balance, and their gait will be what we call hypermetric, which is kind of exaggerated. And they can sometimes have an intention tremor, which means when they go to do something, the tremor gets worse. But most of the time, as long as a cat can get around, use a litter pan, and eat, the signs don't get any worse over time. What they're born with is what they have. And most of these cats are going to compensate. In fact, there's a Facebook page for these kittens, and you go on there, and they can really live a good long quality life in spite of what they're going through.
Yeah, some of our fosters have definitely taken kittens into the home, and we've noticed this. And then, we'll put special waivers on them and adopt them out as is. So I think it's really, really cool that the cats can learn how to navigate, even though they're really shaky and sometimes just like fall over, can't jump as easily as a normal cat, but they can still have really great quality lives.
Right. And most of them can't get on your counter. So that's actually a plus because they won't get on your counter. So now if we think a cat has this disease, how do we test for it? And unfortunately, none of the companies have made a specific test for panleukopenia, but we do have the parvovirus test that we use on dogs. And because those viruses are so closely related, we can use this test to test for panleukopenia. Sometimes we can get a false negative, but you can also get false negatives with dogs and parvovirus too. And false positives, they've done a lot of research on this, and false positives are unlikely. So if we get a positive, we're 99% sure that that kitten has that disease. The way we use it is we use it in kittens with clinical signs, but we'll also use it if we have a kitten that breaks with panleukopenia. We'll probably test all the litter mates to see if any of those are shedding the virus also. And again, I've seen a litter of kittens where one got panleukopenia and died from it, and the other kittens never even missed a meal. So, this disease doesn't always follow an exact pattern. So if I do get a false negative on a dog that I think has parvo or a kitten I think has panleuk, and I'm not really sure, what I might do is just take a little drop of blood and put it on a slide. Because like I said, panleukopenia really means without white blood cells. And if you look at the middle slide, you don't see any of the dark blue cells like you do on the other two slides. So the slide in the middle is an animal with panleukopenia or parvo, could be either one. And then the slide on your left is the normal. You should see a few of the, what we call white blood cells, which are the dark blue pigmented cells. And then the one on your right with all the dark blue pigmented cells, that would be like a bacterial infection. So sometimes just taking a drop of blood, we can kind of say, whoa, I think this kitten's got a bacterial infection, or I think it's got something else because it's got enough white blood cells that I don't think it's panleukopenia. So that just kind of helps us out. Okay, so my take-home message for most people when I do this presentation is that, a negative panleukopenia or a negative parvo test for a dog doesn't actually mean that the animal doesn't have the disease. So no test is 100% on everything, but it is very helpful for us to diagnose this. All right, so if we have an animal that has panleukopenia, because it's a virus, we can do a really good job of preventing, but once they get it, all we can really do is support them. So fluids and electrolytes, because they're vomiting, they've got diarrhea, they're losing a lot of fluid, and these little kittens don't have a lot of extra fluid to lose, so we need to support them with that. We give them things to stop their vomiting, and nutritional support is really, really important also. A lot of times they don't feel like eating because their stomach's upset, but we try to give them medication so that we can get them started eating right away because it's real important. They'll get hypoglycemic or their blood sugar will drop, and if we get some nutritional support, it really helps them fight the virus off. We also will do antibiotics, and you say, well, antibiotics are for bacterial infections. They're not really for viruses, and that is true. But because this virus affects the lining of the intestine, it opens up that area for bacteria to get in. And sometimes what the animal will die of is will die of what we call a secondary infection from bacteria that the virus made the animal more susceptible to. So we do cover them with antibiotics. And this is a painful disease also. Their intestines are really hurting. So we'll often give them pain medication to make them feel better. They have to be in strict isolation. This virus can spread very easily. And anyone that goes in that area where that animal is going to use PPE, personal protective equipment, and they're going to use everything. They're going to use boots, gloves, gown, cap, everything because of this virus being so readily passed from one animal to another. So this is how we prevent panleukopenia. Certainly vaccination is right up there. We have great vaccinations for this disease. Staff education, just like Jen was saying, recognizing this disease really early. So staff being educated on what to look for and what to do when that happens, and also on PPE and how to handle the kittens is really important. Population management, we know that if we overcrowd our cat population, we tend to see more disease. Disinfection is really important too. We have to use the proper disinfectants, and we have to clean those litter pans that have the stool in them, clean the bars of the cage. Kittens can be really, really messy. So we need to do a good job of cleaning. And then early detection. The earlier we can detect something, the more likely we are to be able to treat, and the more likely we are to to keep other animals from getting this if we can detect it early and get that animal separated.
Again, this is so important that, when we're working with, as volunteers are working with these animals in the shelter too, if you are wearing gloves, that's great, but it's not enough. We need to make sure we're not touching other things in the room other than the animals. And once we're done, those gloves get taken off right away, because if we are wearing gloves, but we touch the kittens and then we touch a light switch or a broom, and that kitten is starting to harbor that virus, now that virus is living on the broom handle. And the next person comes along and they touch it and they don't realize, then they've spread it to the light switch, or they've spread it to, the scoop in the litter bin. So those are things that we're talking about, just making sure we're being really aware. Again, humans are the #1 spreader usually, of disease in a shelter environment. So it's really important to make sure we're being mindful, whether we're socializing them or cleaning in their cage. And even, sometimes when we're fostering, especially if we're going between our foster room and the rest of our house, just making sure that we're not spreading disease.
Okay, so vaccination is one of the most important tools we use for this disease, although it's not, you can't say, well, I vaccinated the cat and then I can forget about disinfection or fomite. No, but vaccination is very important. And in the shelter, we use what we call modified live vaccines, which are vaccines that actually have the virus in them and it's been modified. So it fools the body into thinking that the animal has the disease without making them sick. So they produce antibodies to the disease. So if they're actually come in contact with that disease later on, those antibodies kick back in and protect the animal. Now we have to use proper vaccination technique, and this is what training the staff comes in, because it has to be given properly and the vaccines have to be stored properly. So they've got to be kept cold. Modified live vaccines are fragile. And we don't mix them up and then sit them and wait, 2 hours and then go use them. We have to use them. Once we mix them, we use them within 30 minutes. The other thing we have to do is we have to start at the proper age and we have to do the recommended series, which is different than the series that perhaps your own animals are going through at your vet.
Yeah, and the reason for that is like Dr. Cece mentioned earlier, it's a higher risk environment inside the shelter setting. So we usually vaccinate quicker in between their different booster shots, just because we want to make sure we're giving them as much protection as possible.
So we vaccinate at intake. And when I say intake, that doesn't mean I put a kitten in a cage and I go back 3 hours later or at the end of the day. It means as soon as they come in that door, before they go into their cage, they're going to get vaccinated. So right now, we used to do 4 weeks and older. And right now, we've kind of gone down to 3 weeks and older. And there actually is research out there that being done at the university where they're starting to vaccinate kittens at birth. Okay, that was something really new for me, but they're doing that and they're doing studies, especially on shelters that have a high risk of this disease and a lot of outbreaks. They're actually vaccinating kittens younger and younger. So we're doing 3 weeks and older, and then we vaccinate every 2 weeks in the shelter. And again, like Jen said, we're in a high risk environment. So we're going to vaccinate more frequently than maybe you would with your animal in the home that goes to your vet. And then we continue until they're 16 to 20 weeks of age. Okay. And we vaccinate all adult cats unless they have proof of vaccines. Now, when I say proof of vaccines, they would have to come with an actual veterinary signed proof because, just the cardboard little folder that they give out when you first get an animal is not proof. It has to be from a veterinarian. And I would say most of our adult cats don't come in with any proof of vaccines. Uh, so they get vaccinated just like the kittens right at intake.
And I think something that's really common too that we hear is folks don't always realize that that cats should come in on a routine basis for vaccines. So they'll say, yes, my cat is vaccinated. It was vaccinated once when it was a kitten. It was never vaccinated again. So we don't take the risk. We just assume, like, if we don't have record from a veterinarian, that they just need to be vaccinated again because we want to protect them. We want to protect them as soon as they're coming in our doors and make sure the rest of the population of the cats that we're caring for are protected as well.
So we even vaccinate mildly ill and injured animals. And pregnant cats, like I was talking about, they get vaccinated unless there's a high chance of an owner reclaiming. So if I had a purebred cat come in and I had a microchip and I could get a hold of the owner, I would hold off on vaccinating that cat. But that's very rare in our Detroit shelter. The cats that come in, the majority of cats are. We don't know the owner. We don't have any paperwork, and so it's just safer to go ahead and vaccinate them.
Yeah, I would say that's even true at our Westland shelter.
So our reasons not to vaccinate. So if an animal comes in hit by a car and the vitals aren't stable, we're not going to vaccinate because if they had a vaccine reaction, that would possibly cause the animal not to be able to survive that. So if the vitals aren't stable, we'll wait till they're stabilized. If they have a real high body temperature, we don't vaccinate because the vaccine won't work. It works at body temperature of animals, but not that high. And then again, like if they have really good proof of vaccinations, we won't revaccinate, but that's very rare. So this take-home message, I like to tell people that work in shelters, even waiting one day can increase the risk of disease in that cat because we know they've done research where that panleukopenia vaccine has been shown to produce immunity within 72 hours. So that's really, really important to get that vaccine in as soon as you can. Actually, I'd like to vaccinate them before they even come in the shelter. If we could, that would be ideal.
It really would be. The other thing I was going to point out, sometimes another reason for not being able to vaccinate is if we can't safely handle. I mean, that's not ideal, but there are times where, if we can't safely vaccinate, we do have to put an animal in a cage and give them some time to kind of relax to the environment. But ideally, we're trying at all costs to vaccinate as soon as possible.
Yeah. So, and I get asked this a lot too. Um, why do we vaccinate so often? I mean, if I give the vaccine as such a good vaccine, why do I have to keep giving it every 2 weeks? And so, this is I got this from the Correct Shelter Medicine Program, but what the reason for that is most animals, and not everyone, but say the mother cat was vaccinated against panleukopenia and has great immunity. When that kitten is born, she imparts a large amount of immunity through the colostrum to that kitten. Now, as the kitten gets older, that immunity starts to wane. Okay, and so what we're trying to do is we're trying to vaccinate the animal at intervals. So when that maternal antibody gets to a certain point, our vaccines will kick in. Thing is, we don't know when that is. Okay, it can be different. We could have a kitten that comes in at 8 weeks and its mother didn't have any immunity, and I vaccinated at 8 weeks, and I might have protected that kitten if it didn't have any maternal antibodies. But I don't know that, right? There's no way for me to tell unless even if I took titers on all kittens, I couldn't know for sure. So we vaccinated intervals, hoping to catch that kitten when its maternal antibodies drop and its own body can kick in. Now, there's this little window of opportunity that the maternal antibodies, what they do is they kind of block the vaccine from working, okay, which is another reason why we keep vaccinating, because we don't know when that maternal antibody is going to stop blocking that vaccine. And there's a window of opportunity where that vaccine is blocked by the maternal antibodies, but they're not high enough to prevent disease. And so it's usually around 10 weeks. And so that's kind of a window of opportunity where even if we're vaccinating, we still might have disease sneak through. And typically what I find, if it does, the cases are very mild because there is still some immunity imparted. But I've had people that like, oh, I vaccinated my dog or my cat as a puppy and it's still got this disease. And so that's the reason why. So another reason for us to be real careful, and even if an animal has a vaccine, especially with our young puppies and kittens, we got to be real careful and do like Jen said, our gloves, and be real careful not to spread from one to another.
Looks like we have a note in the chat from Sue. I've had friends and family say they don't need to vaccinate their cat because it's an indoor cat. What can I tell them besides it's important? Good question.
Okay, so, well, it is important, and I would say that your indoor cat can definitely sneak out. You know, I've had my indoor cat sneak out every now and then. The other thing is, you don't know when you might expose yourself to one of these diseases and bring it home to your cat. Okay. And then the other thing is rabies vaccines. I mean, that is so important. People get kind of lackadaisical because we don't see a lot of rabies, but rabies is a fatal disease both to the animal and to the person who gets exposed. And we have had bats in the house. Okay. And so we've had people that have woken up and found their cat playing with a bat in the house, and that bat has turned out to be positive for rabies. And if your cat isn't vaccinated for rabies, that sets up a whole thing that, you know, the state of Michigan is going to get involved with all of that. So every cat and dog needs to have rabies vaccines current. I mean, I'm really adamant about that. And even my indoor cats are vaccinated against panleukopenia and the respiratory viruses. Now, I work in a place where I could easily bring home one of those diseases. But even if you're fostering or you're going to somebody's house who might have an animal, it's so easy to carry a disease on yourself, or even walking through, you know, a yard. I mean, you're walking through a field, you don't know if a cat has been there before. On your shoes, you're going to pick up a virus and bring it home to your cat. So even your indoor cat should be vaccinated.
Yeah, the risk isn't zero, right? If the risk
The
was
risk is
zero,
not zero. Certainly, an indoor cat, the risk is less, but it's never zero.
yep. So, I mean, that's again definitely something to tell them to discuss with their vet, because they can kind of discuss what those risks are and, make a decision. It probably is better to do preventative care versus, these diseases that we're talking about that are deadly or very difficult to treat with a high mortality rate.
Yeah, and most of our vaccines now, once they go through their initial vaccines, then they become 3-year vaccines. So it's only every 3 years that they have to get vaccinated. But I would tell you, every cat and every dog should have an annual visit to the vet just to do a physical exam, you know, just to make sure everything's going okay. But most of the time now, you're going to be, once they finish their initial series, it's going to go to an every 3-year vaccine. So, you know, I think it's still something very important to do.
Any other questions from the group before we keep moving on? You can come off mute or you can message in the chat. Oh,
Okay, so this is another take-home message that even properly vaccinated puppies and kittens can contract parvovirus or panleuk if exposed during that window. So sometimes we'll even have kittens in the shelter which have had 1 or 2 vaccines, and if we expose them, we might, if it's in that little window of opportunity, they could potentially get that, and sometimes they have. So again, another reason to be really careful when you're handling puppies and kittens in the shelter. All right, so we're going to talk a little bit about disinfection because we talked about vaccination. Now, disinfection is really important, and you have to use the disinfectant that's going to kill parvovirus and panleukopenia, and the ones that kill the organism in real life. So sometimes you'll actually see things out on the market that'll say, you know, parvo kill or parvo will actually be in the name of the disinfectant. But most of these disinfectants are going to go through testing, not only in the lab, but in the real world. So just because it kills that virus in the lab doesn't mean it kills it in real life. So there are a few that do, our bleaches do, trifectant does, and then rescue. And I like rescue because it's safer on the animal, around the animals, and also on your equipment and on the things that you're going to clean. Where bleach will kill the virus, but it's not very friendly to your equipment and what you're using. So the other thing that's real important with using any disinfectant is to clean first. So if you have a lot of what we call organic material, which is, the feces and everything, and you just put disinfectant on it, it's not going to work. So you have to clean first and get all this stuff off. You have to use the proper setting, which will give you the proper concentration. And then all disinfectants are going to have what we call a contact time, which is the amount of time that needs to just sit there to work. So if the contact time is 10 minutes and you spray it and then you just wipe it, you haven't given it enough time to kill that virus. The other thing that's real important before we put any animal back into its housing is to make sure that that area is dry. We don't want to put an animal back when it's wet.
And I might be getting ahead of it because I don't know your next slide, but really, really important to wear gloves while cleaning. I mean, we talked about wearing gloves while handling the animals, but even though rescue is a safe product for humans to use, it's still a chemical. It still can dry out the skin depending on the setting. It's really highly concentrated. We use the B setting. That's just general cleaning. Unless we're working with animals that are high risk or highly infectious, then we might use a higher concentration, C or D. But unless a staff member or signage tells you otherwise, we're just using the B setting. That's what most of our mop buckets and our little spray bottles are going to have. Our buckets are going to have. Please use gloves if you're using that. Clean first. There's a couple ways you can go about it. I like to use when we have newspaper layered in cages. I know we don't always have that for cats, but when we do, especially under litter pans, those are great to use to scoop up any little fecal material that might be left on the walls. Or you wipe them down, you let it dry, and then you wipe again once you've moved that organic material. So it is a little bit of a process, yes, but when we're talking about how hard it is to get rid of these viruses and how deadly they can be, it is worth it to take the extra steps. And even upper respiratory, it is worth it to take the extra steps, because even though upper respiratory isn't necessarily a fatal disease, it can really be for these immune compromised babies, or babies that have still a fragile immune system because it's developing, right? So we want to make sure we're doing a really good job of caring for them. And it does not hurt to wipe down cage bars, like Dr. Cece said. I mean, sneeze marks can go anywhere. Fecal material can go anywhere. It goes on the bottom of our shoes. That's why in the summer months, we say, please don't go back and forth between working with the adoptables and working with unevaluateds. If you're going to start and do both, make sure you're starting with the adoptable population. They're the most healthy. They've been in care the longest. They've had the most vaccines. We've monitored them the most. Behind the scenes, right, the kitties that are still waiting to go up for adoption, they're going to be a higher risk for potentially coming down with something or not have completed their vaccine series. So we start with adoptables and we move our way to the back, and then it's always healthy to sick, right? We don't want to work with sick animals and move to healthy, because even though we might be wearing our gloves, we might be wearing our gowns, we might be really careful, it's really easy for us to make a mistake. We're humans, we're not perfect, and carry something and transmit it. And especially now in the summertime when populations are high, immune systems are more compromised due to more stress, and it's more easy to spread disease at this point in time.
Okay, so especially if you're using something that you know in your home that you want to make sure that it kills parvovirus, just remember that just because a label says it has parvovirus in their title, or even if it says it kills it in the lab, doesn't mean it will kill it in the real world situation. So if you have a question about that, you can always ask one of the veterinarians, hey, I want to use this, does it really kill? And we can look at that label and we can tell you. And especially if you're using a bleach product, boy, you have to remove all organic material, because any organic material in a bleach product will inactivate it, as will sunlight. So, and bleach can actually expire. So if you're using a bleach product, you've got to make sure that it has, that it's fresh. You don't want to use something that's been sitting around for 5 years and then dig it out from underneath someplace.
Cece, I think I remember that bleach mixture after 30 minutes, it's no longer at the potential to kill the germs. Is that correct?
Yeah, you have to use it right away. Once you mix it up, you have to use it right away. It can't be exposed to light, so it's got to be in a container that light can't get through. So, which is why we gave up on foot baths, because as soon as you stick your foot in that foot bath of bleach, it inactivates it. So, we don't use those anymore. All right, so here's another question I get. So if I've had an animal that's had panleukopenia, how long do I have to leave that cage empty? And I will tell you that because it's a very stable virus, you can leave that cage open for a couple months and it's not gonna be safe unless you clean it properly. So if you clean it properly, okay, so if you cleaned it once and you cleaned it properly with something that killed panleukopenia, and you let it set for the right amount of time and you removed all the organic debris, you could put the cat the same day, another cat right back in that cage. So usually what we'll do is we'll recommend cleaning all the organic material and then disinfecting either 2 or 3 times. And the reason that we do it more than once is because nobody's perfect, and sometimes you'll clean and maybe you miss a corner or something, and if you go back and clean again, hopefully you'll catch what was missed and everything will be clean. So cleaning it once is real important. If you do it right the first time, by the once you dry it and get everything done, you should be able to put another animal right back in that cage. So cleaning is so important. I can't stress that enough.
I'm just going to add too, as being a person who's cleaned a lot of cages in the shelter, it is very hard to clean it the first time, because poop is it like sticks to the surface, right? If it's dried on, and as we learned, this virus in particular is spread through feces. So you a rescue is great; it's got a degreaser product, but you kind of have to put it on there and let it sit so it makes it so you can easily wipe the poo off. And it can get a little sudsy, especially if you're using the higher concentration. And so sometimes you can't even see, especially upper respiratory, that you've gotten all the gunk, all the organic material off the cage, because poo, snot, saliva, that is all organic material. So sometimes you just have to wipe it down once to even get the organic material off. So yeah, we clean everything at least 3 times. And if we've had a Panleuk positive, usually we're deep cleaning the whole room, not even just the cages. Like we're getting the backs of the shorelines, under the shorelines, hosing down the walls, hosing down all the materials in there. And if anything can't be cleaned properly, so like plastic materials, they're porous. A lot of times we'll toss those out if there has been a positive case, and we only sanitize or deep clean metals. So plastics and linens usually will be bagged up and tossed out just to make sure that we're doing a really good job of cleaning. And again, not letting the virus live on within the shelter.
Okay, so if an area isn't disinfected properly, you can wait an extra week, but that panleukopenia isn't going to die in that week. So clean, clean, clean. Okay, so some other things to prevent disease, avoid overcrowding. Just like Jen said, the higher your population, the more you're at risk, not only because there's more viruses and germs going around, but also because overcrowding stresses animals, and then there goes their immune system. So real important that we keep our portals open and don't overcrowd. Stress, again, real important. Our enrichment is so important, and keeping the cats, giving them a place to hide, really important to keep the disease under control.
Yeah, so this is really where our volunteers and fosters come in handy, because even though staff do a really great job of meeting all their physical needs and still get to spend time with them, it's not the same as it would be in a home environment. So our Positive Start volunteers really come in and they make sure that you're spending that extra time, that TLC, to reduce stress, especially during this time of year. Sometimes it's not always because they're scared, it's because they're not getting as much attention as they would like, or they can be overstimulated. So time playing with toys in the cages, petting, just even seeing and hearing people can help reduce stress.
Good nutrition is another thing. If we help with it, build up their immune system by feeding them appropriately, proper amount, and the proper food. Parasite control, again, they've done studies where animals that are loaded with parasites, their immune system just can't function as well, and they're more likely to get disease.
Gloves, gloves, gloves. Even when changing litter pans, even if you're not seeing any loose stool, please wear those gloves because we could be protecting the animals, especially, those kittens. We don't want them to catch anything because their bodies aren't as hardy as adult cats.
And again, like we said before, early detection, catching it really easy so we can separate the ones that are sick and quarantine the ones that are exposed. And staff training. Important that we all know what to look for and that we're all giving vaccinations properly, taking care of those vaccines the way they should be, and cleaning properly.
Yep, and that's why we're bringing this presentation to you guys too, because the more we all know, the better we can do at keeping them safe. So you guys definitely play a role in this too.
So if unfortunately we do see this disease, now what do we do? So the first thing, early detection, we identify those that are affected, and those are separated and they're what we call isolated. So they're separated from the population. And then the cats that are exposed to the disease, they get separated also, and they're under what we call quarantine, because we'll go through those animals and we'll do what we call a risk assessment. We'll say, how exposed was this animal? Was it in the same cage as the kitten that died, or was it an adult cat that's, way down the row? And then we'll also look at the age of the animal. If the cat's 8 years old and it's been vaccinated more than once, that cat is protected against panleukopenia, and he probably can just go right on his way. And is there immunity? How how long has this cat been since it had a vaccination? So, if the vaccine was just a day ago, it really hasn't a chance to work. But if that cat was vaccinated a week ago, it's had time to build up that immunity and may be able to not have to spend, the 14 days in quarantine. And so this is just, this is a picture of actually our parvovirus ward, which, puppies go in here that have the disease, and everything that goes in that room stays in that room. Nothing comes out. Any linens, like Jen said, anything that's linen wise is put in a bag and taken right to the dumpster. But everything else that goes in there, like the scales and anything else, just stays in that room. And then what we put the kittens in quarantine, any kitten under 4 to 5 months of age is going to sit in the, they're going to have to be quarantined, because again, we're just not sure where they're at with their antibodies, with the maternal antibodies and everything. And adult cats that are recently vaccinated. So if that cat had a vaccine just 24 hours ago, it could have been exposed, and we're going to put that in quarantine. So they're going to be quarantined for what we call the incubation period. So remember, we said if a cat is exposed, usually, it's going to be 5 to 7 days, but can be as long as 14. So we're going to quarantine them for 14 days from the time that they were exposed. And then if nobody breaks during that time, then they can all come out. If somebody breaks during that, for say a weekend, somebody gets Panleuk and we detect Panleuk in that room, we have to restart the quarantine for another 14 days because we assume all those animals were again exposed. And then we remove them from the quarantine if the incubation period has been long enough, and we'll double check and make sure, and none of the animals are showing any signs of panleukopenia. And then isolation. If an animal is sick with either parvo or panleukopenia, they can be removed when all their clinical signs are done and when they have a negative parvo snap test. And we usually do 2 in a row. Most of the time, they talk about panleukopenia can be shed for up to 6 weeks, but typically after 2 weeks, most of the time they're shedding so little, nothing more than really what the average cat coming in here might be shedding. So usually we say 2 weeks is good enough. Now, and if we do have an outbreak, say we have an outbreak, okay, the first thing we're going to do is we're going to go back and make sure. Now, if a kitten comes in and 2 days later it breaks, I can say that cat came in with it, right? That kitten was incubating that disease. It didn't get it in my shelter. There was nothing I could do. We took it in, it looked healthy. It was incubating the disease. But say I have a kitten that's been here for 2 weeks and gets the disease. Could it be the window of immunity, that susceptibility? It could be, but I'm not going to take a chance. If I think a kitten got it in my shelter, I'm going to go back and I'm going to review every procedure and protocol that I have. I'm going to make sure that these vaccines are being given. So I'm going to look through all the animals and make sure all the vaccines are given and they're given at intake. I'm going to check the refrigerator, make sure my vaccines are cold enough and they're properly stored. I'm going to go back and look and see, are my animals moving through the system as fast as they should be, or puppies and kittens just kind of hanging around, being exposed to the disease more than they need to? And again, I'm going to go back and look at my cleaning protocols. Am I using the right disinfectant? And am I doing the right contact time? Am I doing everything right? So anything like that happens, we just go back and we review everything to make sure that nothing that we did was inappropriate. And that's it. So and we'll take questions.
I have a question about cleaning protocols. So what if you have like some foster kittens and then you take them in because like they're not eating or they're showing symptoms? And then what would the cleaning protocols be if they are diagnosed with Panleuk? Would you have to like throw everything out that you have at home and like get rid of scratching posts and toys and what if the room you have them in you have carpeting?
So and are these kittens just segregated to one part of the house?
Yes.
Okay. So and is it in a room that has carpet?
Yes.
Okay. Were they like did they have the free run of the room, or were they
Yes.
just in one, they had the free run of the room,
Yes.
and they came in and were diagnosed with?
Oh, I'm just like I'm just saying like what if?
Okay, well, okay, and probably Jen can speak to this too, because with foster kittens, we really, really stress having them in a room segregated that's easy to clean and easy to disinfect. So I wouldn't want my kittens to be in a room with carpeting just for that reason, because to disinfect a carpet, I mean, you could steam clean it and reduce the number of virus in there. Um, but it would be really hard to totally disinfect that. So, like a playpen area, or I've used those mattress pads that the water doesn't go through, to put a X pen around so the kittens can't go onto the carpet. But if someone has segregated the kittens to the point where they know they can disinfect that area very well, um, then that may be something where we can just, if they can clean it up, then they can go ahead and take kittens again after a certain length of time. Um, we've had some people that have had Panleuk kittens, and then we tell them with anything else, that if they want to take a kitten that's been exposed, or, once you're a Panleuk home, if you want to do the, take care of Panleuk kittens, that's one thing. Um, but I wouldn't have a kittens running loose in a carpeted area just for that reason, because if they did break, it would be really hard to get that cleaned up. And I don't
Okay.
know, Jen, do you have like a protocol with the fosters, how they're supposed to house kittens like that?
Well, this is more of a Lauren Niffen question than a Jen Rosen question, but
Okay.
yeah, I mean, I kind of in the same way. I've always housed my kittens in a large dog, like extra large dog crate, or like you said, Dr. Cece, put towels or sheets down all over the carpeted area. I had carpet. I couldn't avoid it. There were no rooms, spare rooms. Occasionally, I've fostered like really messy kittens and kept them in my bathroom because it's tile, much easier to clean than a carpeted area. I do know that we've had a couple of foster homes with kittens who have broke, and then they have to be basically, there's a quarantine period where their home is being deep cleaned and they can't have kittens. I don't know if it's for the rest of the season and it doesn't restart until next year, but I can't answer super specifics on that. I do know that was going to be a question I was going to ask for you, Dr. Cece, is if kittens do test positive in a home and they seem to be thriving and doing well, I know sometimes they just really go downhill fast, but could they be treated in a foster home for Panleuk if they had it?
Yeah, so we had one not too long ago where the kitten came in and tested positive. Wasn't too bad, okay? And so we treated supportively and gave the person who was fostering wanted to try to foster the kittens, and she was very comfortable. I think she might have been a nurse. She was very comfortable giving fluids and medication, so we gave her all the supplies she needed, and as far as I know, the kittens all survived. And the reason we don't do that in the shelter is because I don't have a place to put those kittens that wouldn't expose other kittens. We have a real nice parvo room where we can put dogs or puppies that have parvo, but I don't have any, and we have, trust me, we have gone through this whole shelter and tried to find a place where we felt it would be safe to put kittens that had that disease, and we have not been able to. So if we ever build another shelter, there'll be a Panleuk room along with the parvo room. But if people want to take them in their home and treat them as fosters, we will help them do that. Yep.
Okay, thank
Um,
you.
Sue, yeah, I was gonna say, is there anything else that we could answer? Again, I don't know that I have all the answers, but
Oh, no,
we can
Well,
get
that helped a
answers.
lot. That helped a lot.
and I would say that each time that this happens, like if somebody has a cat that breaks with Panleuk, it's in a foster, each time is it's we take it as an individual and we talk to the person, where was the kitten, where were the cats, what were they doing? Because it might be different for one foster home versus another. So, we try to work with this person because I know a lot of times if they have a Panleuk kitten, they don't want to stop fostering for the whole season, and we'll try to see where that kitten was and how much exposure with that home was before we make the decision. It used to be typically a 6-month wait before you could take another cat home. But you could take an adult cat that's vaccinated, then I wouldn't have any problem with you fostering adults. It's just with kittens, you would have to wait. That was usually our protocol, is 6 months.
Dr. Cece, real quick question, and I don't know if it's already been touched on. I left a question in the chat, but can the virus be passed from cat to dog or dog to cat?
So theoretically, yes. Okay, theoretically, I think they have maybe like one report of that happening, but we don't seem to see it in the shelter. Um, but theoretically, so we would not mix. I think you're asking because like if you got a parvo room, you know, why
Mhm.
can't you do them together? But theoretically, there's a possibility because they're so closely related that they could mix. And the thing is, when we test the kittens for Panleuk, we're using a parvo test, so I can't really tell you exactly which disease they have. But I would say that theoretically, and I think they've, like I said, I think I've read about one or two instances where it's possible or it happened, but it's not common.
Okay, thank you.
Yep.
Any other questions? You can either come off mute or add it to the chat. Questions? I mean, Dr. Cece, you did do a great job. Very thorough,
Well,
informative presentation. Much
and I
appreciated.
appreciate you jumping in with a volunteer specific stuff because that stuff I don't know all about. I know a lot about the disease, but that was very helpful.
Can I ask a quick
Yes.
question?
Yes, please, Diane.
Okay, so say I'm volunteering doing unevaluated cats and there's so many kittens and everybody looks healthy. It's just kind of a normal day. When in training, I know we're told to not hold the kittens because of the fact that they could, be sick or something like that. So is there any kind of guidelines you can give us as far as like if a kitten's a certain age, they're okay to hold, or should we avoid holding them in an environment where everybody seems healthy?
So this is
And
a
they're
great,
sometimes they're so cute. They're older and they need that human contact. But you're not sure sometimes if we should hold them or not.
Yeah, this is a great question. And just so everybody knows, Diane is specifically from our Westland shelter and does both adoptables and unevaluated. But in the unevaluated area, just like at Mackey, we don't really have a space for the kittens to go out or cats to go out and be socialized. So most of it is in cage enrichment. But I hear what you're saying. Those little babies, sometimes they are just desperate for love and attention. Um, and you want to make sure that they're getting what they need. So I would say this, and Dr. Cece, I would love for you to jump in after and tell me if you feel differently. And one of my goals is to eventually split out positive start adult cats and positive start kittens, just like we've done for puppies and adult dogs, because I do think there should be a little bit of different guidelines. But what I would say, Diane, is anybody under, I would say, like 5 to 6 weeks of age, I would leave them be unless you're specifically doing a role like shelter care or kitten care, which is right now a Mackey only, so a Detroit only role where volunteers are coming in and making sure they're getting their afternoon feedings. I would leave those guys be. And I know it's hard. I know it's hard because they need love and they need attention, especially if they're a solo kitten. It can be really hard because they're almost begging, but those are the most susceptible. They haven't had that many vaccines yet because you think about when we're starting it, it's 3 weeks of age. So if we're waiting till they're at least 6 weeks of age, they've had a couple of vaccines in their body, they're probably getting closer to that range where they can move from the front of the building to the back of the building. We actually spay and neuter at 8 weeks. Honestly, we're trying to get them in a foster home if they're under 8 weeks and they can't be they can't be spayed and neutered yet and go up for adoption. So 6 weeks to me is the youngest that I would feel comfortable with volunteers socializing those babies, and definitely make sure you're using gloves. And I don't want to say that you couldn't ever use a towel as a barrier to hold or to transport them somewhere, but you really do need to be careful because at this time of year, there's just such high chance of disease transmission. And even though we might be socializing them, we're not doing them any favors if they catch a virus. So that's kind of how I feel about that, Dr. Cece. Do you have anything that you would want to add to that?
Well, it's always a struggle with enrichment and medical, okay? Because our puppies that are in quarantine or in isolation, we have to do special enrichment for them because we can't take them out. And it's always a trade-off. So no, I agree, anything under 6 weeks certainly is high risk. Um, and you're right that at that point, at 6 weeks, hopefully they'll have at least one shot in because we vaccinated intake, and they may actually have two. And again, it's always a balance. If you feel that you really need to socialize and you're allowed to do that as a volunteer, then that litter after that, then you're done. You don't touch another litter of kittens. That's the only way you could do that, because you can't go from one litter to another litter without, even if they look healthy, without potentially exposing them.
Yeah, and PPE definitely, because you don't want to hold to you and then your shirt, right, has the
Yeah.
things on there. And kittens, I mean, it's more likely if you're socializing kittens that you're going to spread disease because they're messy. Their fecal material goes all over the cage. They step in their feces sometimes. They a lot of times have soft stool because their body is getting used to eating those solid foods and they're transitioning from, milk, mom's milk or gruel, to eating dry, and they're just all out of whack at that age. So best case scenario, I would say socialization 8 weeks and up. But I don't want to never say ever because we do have some little babies that really just do need it. And, Sue put in here as I'm guilty of wrapping singletons in a towel and cuddling them. Hey, if you have a gown on, they're wrapped in a towel, you're wearing your gloves, they just want to lay in your arms and purr, we're not gonna like call the police on you. You know, it is really important to make sure they're meeting their mental needs and they're not like screaming their heads off and they're just going to get upper respiratory if they feel like they can't get any socialization. So I don't want to say ever, but we do have to use good judgment. If they're having a lot of loose stool, if they're really skinny and looking punky, so, you know, not super active, avoid. Avoid, do not go in those kennels. Ask questions if you're unsure. You just don't want to spread any disease. So it's not an exact science. We're still working on that, but it's better sometimes to leave them be until they're a little bit older. So those would be my recommendations. Another question came in. This one's from Carol. If we are fostering the kittens, can we cuddle them? Of course.
Yeah, just don't cuddle them with the same clothes that you came home from the shelter with. Okay, when you come home from the shelter, everything goes in the washer and you put clean clothes on, then cuddle your kittens. Cuddle away. Yep.
A lot of the stuff we're talking about is specifically in the shelter environment, and again, because it's high risk. We're talking about cats that aren't fully vaccinated. We're talking about cats that are under high stress. Talking about cats and kittens. We're talking about a place where even though we try really, really hard to be thorough with our cleaning, again, all it takes is one mistake for someone to have gloves and touch a door handle or a cage bar, you know, just to make sure it's closed, and then the germs are there, right? At home, while there may be germs, you're not spreading them to anybody but your foster kittens, and it's their own germs. So you have a little bit more leeway with those guys. You absolutely should be cuddling them and loving on them because those are ages where it's really important to socialize them so they are comfortable being touched and picked up and handled. So they're ready to go to an adoption home and they're not afraid, right? People want to adopt social animals. So that's a great question. Any other questions? All I can say is if you're ever unsure, it doesn't hurt to check in with someone. It's better to ask questions. You're not bothering anyone. We rather you take extra precautions during this time of year where disease transmission is very likely and populations are high. So we're dealing with animals that are stressed and will have a weakened immune system. And we have been seeing a lot of Panleuk in our populations, not just at Michigan Maine, but, you know, coming in from the community over the last several years. So it's really important to just be a little bit more aware and ask those questions. It's better to stop and pause than take a risk and potentially have, you know, 2 whole rooms go under quarantine or, you know, kittens that all of a sudden are really, really sick. And like Dr. Cece said, we can't treat Panleuk positive cases in the shelter while we can quarantine. We can't have entire cat rooms become wards because the likelihood that we're going to spread the disease is very, very high and mortality rate is very, very high. So we need to think about the larger population and protect the other babies that are coming into care or that are living in care. So it's just better to ask, to take precautions and ask questions, use that PPE. There will be other cats and kittens that will need you just as much. So focus your energies on those. Those would be my recommendations. All right, I think we're going to go ahead then and end on that note. Thank you so much to everybody who joined us today. If you have other questions, don't hesitate to reach out to me, jrosen@michiganmaine.org. If I don't know the answer, I can reach out to Laura Niffin, our foster manager, or I can send those on to Dr. Cece. If you have building specific questions, you can also send those to me. And this was just more of a general overview. The quarterly meetings are where we kind of get a little bit more specific to each location. This recording will be shared out and will go out in the newsletter for anybody who missed it, or if you want to spread it around to fellow volunteers, we'd appreciate that. And we'll also be sending a survey. So give us your feedback. Let us know if you like this and what we can do better and any other information you'd like to learn from us. All righty. Thank you again, Dr. Cece. Excellent presentation.
Thanks everyone for coming.
All right. We'll see y'all later.